Do you have a friend who wants to know what exactly he has to do to increase penis size? Question mark. My name is Eduardo García Cruz. I'm a urologist, and for more than 15 years I have been helping men who have problems in the sexual sphere, in the male sphere, and in this video I am going to explain to you what my vision is on what is the best way to lengthen the penis and what you have to do. First of all, I have told you in other videos that a small penis is considered small, how to lengthen the size of the penis, but in this video I want to explain not only the treatments that there are, but also what my particular position is and how I think you have to do it for the best results. First of all, my advice is to use a penis extender for 12 weeks. All the men who come to a consultation asking for penis enlargement surgery, I tell them the same thing. Okay, great, but first you will use a penis extender for 12 weeks. The penis extender, there are quite a few studies that show that it is effective in lengthening the size of the penis, firstly. Secondly, we know that the gain in size is consolidated, that is, you will not lose it over time, and thirdly, this increase in length does not entail a decrease in fitness, which is a question you ask me a lot. So I would start using the extender. My advice is to use it every day, and my advice is to use it every day for at least 2 hours. I know it is a long time, but really if we want to achieve a significant increase in penis size and an increase in 12 weeks through attraction, then we need to use a penis extender more or less constantly, more or less daily, and for quite a few hours. So that would be my first piece of advice. Lately many men ask me about water pumps and vacuum pumps. So far there is more literature with penis extenders than with water pumps, but in essence they should work exactly the same. The vacuum pump or the water pump does it. What it does is generate negative pressure, and what it does is introduce venous blood into the penis, and that produces an erection. You can complement the penis extender with the water pump or the vacuum pump. The only thing that worries me perhaps a little about negative pressure pumps is that you are going to have an erection, or you are going to be forcing venous blood to remain a lot of time on the penis, and I doubt that anyone knows what effect it has in the long term. Why am I telling you this? Well, because in the end when you have an erection, normally what you do is fill the penis with arterial blood, and that arterial blood remains stagnant, and little by little it is replaced. But nevertheless, when you use a vacuum pump, what happens? Well, you are introducing venous blood into the penis. It is a blood that is poor in oxygen, poor in nutrients, and therefore having that blood accumulated for a long time there, I do not know what effect it could have on the health of your endothelium, of the arteries, that make the penis work properly and have an erection. It is a question that you usually ask me. Possibly in the last year or 2 years many more people ask me about vacuum pumps and water pumps, and they seem like a good alternative to me. I doubt that it is reasonable to recommend that you use a vacuum pump or a water pump for 2 hours each day. I think that a daily erection for 2 hours of venous blood does not seem like a great idea to me, but as far as I know there is no study that says otherwise, so I leave it to your choice. What you would surely use a penis extender is what is most proven to work today. Secondly, what is the second thing we can do? The second thing we can do is surgery, but always after those 12 weeks. What does the surgery consist of? Well, with surgery we can do penis lengthening, we can do penis thickening, or we can do both. We can do thickening and lengthening surgeries, which are usually the ones that people usually ask for the most. In lengthening surgeries we can do things at 2 or 3 levels. The first is we use an incision that, when closed, pushes the penis forward. It is an incision, for example, it is a vulvoplasty, which is very common. The second would be to section the penile suspensory ligament and close that space so that once the penis falls, it falls forward so that it does not retract again, which is the main risk of that operation. Sometimes when the penile jockstrap is cut, the inflammation that occurs here causes the penis to go back and fibrose, and we lose length instead of gaining it. Therefore you have to be very careful with that. This would be the second thing that can be done in surgery regarding lengthening. a group of techniques that are actual penis enlargement, which can be disassembling the penis completely and putting it between the glands and the corpus cavernosum, putting tissue, or even what are called sliding techniques. I think this group of techniques should not be done. Technically they can be done, but the risk you run seems like an enormous risk to me. The benefit that we are going to achieve with a sliding technique or with a tissue interposition may be 2 to 3 centimeters or something like that, no more, no more. And the risk you take is an enormous risk, and therefore I do not recommend it. To date, I believe that there is no technique for lengthening the corpus cavernosum that is good enough to be recommended, let's say, generally. Regarding thickening, we can basically do 2 things. The first thing we can do is inject material that can be, for example, hyaluronic acid. It can be fat. Liposuction is done, it is prepared, that fat is worked on and re-injected again. It can also be done with hyaluronic acid. It is a simple procedure. It is a procedure that causes few problems, generally speaking. The main problem with this type of injections is that the distribution, although at first all the before and after photos usually look very good, but this tissue sometimes is not perfect. It atrophies in one place, it is irregular, and it has to be injected again, and that is something very common. If you inject yourself, you may have to re-inject yourself more or less periodically. The second thing that can be done is, instead of injecting a liquid, is to put something solid. You can use tights, you can use fat pills that we can remove from various points of the body. You can put prosthetic material to physically thicken the penis. The great advantage that this has is that, logically, this material is not likely to be reabsorbed. The problem is, especially from my point of view, is infection and histocompatibility. That depends a lot there. Each surgeon works with a certain type of material, which is the one that generates the most confidence in us, but none is free of problems. Then, after surgery comes the third part of the treatment, which is using the extender again. As in almost all penis enlargement surgeries, we are going to section the suspensory ligament. What I recommend is for 12 more weeks, when the scar has healed, when your surgeon advises you, use the extender again to avoid retraction, okay? So, we use an extender to keep the penis elongated so that this surgery, that inflammation, that scarring, does not tend to retract everything. Therefore, as I would do step by step, it is extensor, 12 weeks, surgery in those patients who want it, lengthening, thickening, or both, and then 12 more weeks of extensor. Some men ask me, hey, if the extender works for me, can I still use it? Well, I think the answer is yes, right? If you use an extender, it works well for you, you have one. On average, what the articles say is that with the extender you will gain between 1 and 2 centimeters in 12 weeks. I don't see any impediment to you being able to continue using it. It seems to me to be a much safer technique than surgery. The results seem much more predictable to me, and logically it has many fewer side effects. Although it is also true that it logically requires a very important effort on your part. But this would be my summary of how to lengthen the penis step by step. I leave you here a link that will interest you, the same as in the video description. If you found this video interesting, give it a like and subscribe to the channel. You know I have a friend who has a lot of videos about urology and male sexuality. All the best. Bye.